זאתי רחל, והיא מתעסקת במחקר סביב הכאב וכאב גם תחתון, ואני אשאל אותה כמה שאלות. Thank you, Rachel, for answering my questions. Why is back pain so important?
It's because it's the number one cause of disability worldwide, and the burden of the disease of the condition is increasing rapidly with the ageing population and the increase in the population.
What does it mean, the burden of the condition?
The burden in terms of people being disabled, so not being able to do their normal activities, not staying at home, not being able to work, not being able to look after the family. The burden has increased by 50% since 1990, and it's getting worse, particularly in developing countries.
Okay, and if I have back pain, what should I do?
If you have back pain and you have no worrying features, then you should do 4 things.
Yeah.
You should stay active. You don't need to see anybody about it. You should know that it will get better, just like the common cold. You don't need to have any imaging. You don't need to take strong painkillers, and just stay at work, do what you normally do, and it will pass.
Okay, but people told me about bulging discs and degenerative disc disease and all this kind of scary stuff they are finding in MRI. Shouldn't I do an MRI?
We know that these findings are very common in people without back pain, and the older you are, the higher the proportion of people that will have these changes in their back. So in an individual person, they usually don't mean anything. We don't know what causes back pain for most people. So the imaging only can cause harm. It can cause you to be really worried because of what the report says. It might lead to further tests and further treatments that are really unnecessary, and they might have side effects. So it's better, usually, if you have back pain that's typical, that you don't have any past history of cancer, or you haven't had a major fall, you're not an IV drug user. So these things that might increase the risk that you have something serious, then most people don't need to worry. Just treat it like a common cold.
Oh, so in a common cold, I'm going to lie in bed. So what should I do now?
We know that resting in bed is actually harmful for back pain. So if you rest in bed for more than 2 days, you're actually worse off. So we know that it's much better to stay active, to do your usual activities if you can, but you might need to modify them a little bit. You mightn't be able to walk as fast or do everything exactly the same, but you'll get better quicker if you keep doing activities and you keep active.
Which kind of activity is the best?
It doesn't, if you're talking about exercise, it doesn't matter what exercise. They're all much the same. In studies that have compared one to the other, they're all about the same. So I would say things that you enjoy doing. I love swimming. Even if I have back pain, I still swim. If you like walking, if you like playing tennis, whatever you normally do, you can continue to do it.
What if I don't like anything? I like sitting at home and watching TV.
Well, then you're at increased risk of developing back pain, and you might be more disabled as a result of it. So we know that people who are more physically active, that can actually prevent or reduce the risk of recurrence of back pain. So I think you should think about being more physically active, and that will also have other beneficial effects to your health. We know that people who are more active are healthier.
And you are really, really against surgery. Why? How come?
I'm not against surgery.
Back surgery.
It depends for the indication, but for non-specific back pain, the evidence is that surgery is not terribly effective, but they have a high risk of causing harm. And we know that stabilising the spine, there's no evidence that's important for back pain, and many people who have surgery have ongoing back pain after the operation.
So can I sum your sayings? If I have back pain, I shouldn't go see a specialist. I just need to move around and see what happens and do exercises and keep on living my life. Is that true?
That's true, and I think the important things are that you don't need strong painkillers. So opioids, like strong medicines, usually aren't very helpful for back pain, and they have, again, lots of potential for side effects, particularly in older people. So I would avoid opioids as well.
What about NSAIDs?
NSAIDs, again, most people, you can take them, they might help you do the exercise a bit better, might make you move freer, but you only need it for a short time. And make sure that you don't have any reasons why you shouldn't take anti-inflammatories. So many people have other conditions that increase the risks of using anti-inflammatories.
Should I go and see a therapist? A physical therapist or any kind of
so if
therapist?
the pain, so for people that have, when they have the beginning of the pain, if it, at the beginning you don't need to see anyone, it will get better just as quickly if you see a therapist or if you don't. But if the pain persists and you're getting worried, then it's reasonable to see a therapist. You might need some reassurance that it's going to get better. They might give you some exercises that might make you feel better. And so just to get some advice, it's not a bad idea to see a therapist, but only if it's not getting better. I would usually wait some time before you run and see a therapist or see a doctor.
Okay, thank you very much for the interview. I know it was a hectic around here. Thank you.
Pleasure.
Thank you very much for listening.